Hi, my name is Marcia. I'm a family nurse practitioner. I want to talk a little bit more about diabetes, but focusing on the A1C and the fasting blood glucose. And what do these numbers even mean? Fasting blood glucose, this is how it's abbreviated. This is the one that patients do at home when they're sticking their fingers. This one is supposed to be, the range is 70 to 129. This one pretty much shows what your glucose, what your sugar is doing right when you stick your finger. We used to only give this monitor, this is the home monitor. We used to only give this to patients who were adjusting their insulin. Now we give it to anybody who's diabetic. But the best time to check your sugars is first thing in the morning before breakfast. If you're not adjusting your insulin, you really don't need to stick your finger throughout the day or before bedtime because your numbers are going to be higher. The morning one is the one that you want to have your diary for. So the one that we do in the clinic is called the A1C. This one is the one that's done in the lab and in the clinic. This one shows what your sugar has been doing for the last 4 months. So just to give you an idea of how this one works, when the red blood cell leaves the bone marrow, it circulates in the bloodstream for 120 days, and it absorbs glucose or sugar like a sponge. And that's how we come up with the A1C. I don't know how they figure out the technology, but that's how we get the A1C. So this is a more accurate reading of your sugars, okay? So a 5 over here is equal to 100 over here, okay? So this is normal. Pre-diabetes is from 5.7 to 6.4. The 6.4 is what gets you to that 129. 6.5 is equal to 130, and that's pretty much where we start to diagnose diabetes, okay? Now, and then a 7.0 gets you to about 150, and a 7.5 gets you to around 180, and then 8.0 gets you over 200. Now, depending on, how these machines are calibrated, I've seen these numbers, I've seen these slightly different. It might say 200 at the 7.5, it might say 200 at the 8.0. So this is kind of like just an average. Now, the reason why I wanted to talk about this is because I actually had a lady that had a 13.2. She was Japanese and she was on insulin for 15 years. And I told her, I said, what did you used to eat when you were in Japan? She said, I used to eat steamed rice, vegetables, and a little bit of fish. I said, go back to your Japanese diet, stop eating the standard American diet, and go back to your Japanese diet. Come back in 3 months and let's recheck your sugar. She came back in 3 months. This was her number. No changes. I told her how to wean down her insulin. I actually had to end up taking her off her insulin, and I left her on her oral medications, but that's what she did with diet. I also had another lady that had an 11.0. This lady had a wound on her foot that she had been nursing this wound for 2 years, going to a wound clinic. And I said to her, well, I can tell you right now why your foot's not going to heal. She said, why? I said, because your sugar's too high. There's no way your foot's going to heal when the sugar's this high. She said, well, why didn't my doctor tell me that? I said, I don't know, but I'm letting you know, until we get your sugar down, your foot's not going to heal. I'm going to have to put you on insulin. She said, no, I will not get on insulin. I refuse. I will not stick myself with a needle. I said, okay, are you willing to make some diet changes? She said, yes. I said, okay. So this is what we did. Long story short, we changed her bacon, egg, and toast breakfast into oatmeal with fruits and vegetables. We turned her chicken sandwich, it was her turkey and her ham sandwich for lunch, into a nice hearty salad. And then I said, you can keep the chicken and the salmon for dinner, but make it a very small amount. Put more vegetables and like potatoes and yams on your plate with just a little bit of the chicken and the fish. And within 3 months, her number went down to 9.2 and her foot healed. She was on oral medications and I did not change any of her medication. This was done with diet alone. And this was done with the lady just going all the way, you know, just getting rid of all the animal protein. So basically, I just wanted to make sure you understood the difference between the A1C and the fasting blood glucose, because a lot of patients, they're sticking their fingers, they have no idea what ranges they're supposed to be in. You really are, we do like you to be in the range of 7.5 and under, because anything above this range is where the blood vessels get damaged. So the blood vessels, they're starting to get damaged, and then the eyes, the tiny blood vessels in the eyes are getting damaged, the kidneys are getting damaged. This is where you start getting into erectile dysfunction, because even that gets kind of damaged. That's a horrible, but you know what that's supposed to be. Okay? Thank you for listening.